For more on the Ebola crisis now, I'm joined by Dr. Joel Selanikio. He is the CEO and co-founder of Magpie, an award-winning mobile data collection software used for health and international development. He is also a former CDC epidemiologist. And Dr. Joel Selanikio, welcome back to the broadcast.
Thanks for having me, Susan.
Thanks for being here. Well, you heard Dr. Anthony Fauci say today that a mandatory quarantine of health workers that we're talking about in the United States returning to the U.S. from West Africa after treating Ebola patients is excessive. The CDC here in the United States says this mandatory quarantine will discourage health workers from wanting to go to West Africa to treat people. You as a physician yourself are going to be going to treat those affected. Would this discourage you, and do you feel like it would discourage others in your profession?
I don't think it would discourage me, and I think many people will go despite the possibility of being quarantined for 3 weeks. But I think what we really have to recognize here is that everybody on both sides of this wants exactly the same thing. Everyone wants to avoid missing someone who becomes contagious and symptomatic at the moment they do. Everyone, I think, also recognizes that the science shows us that people who don't have a fever and are asymptomatic are not a threat. Mm-hmm. And so I do think it's excessive to say, well, we're going to quarantine everyone coming from West Africa who's been treating Ebola patients. We're not just going to monitor them. We're not just going to take their temperature 3 times a day. We're going to keep them in a tent at the airport. Right? That seems clearly excessive. I think it also ignores the fact that we have healthcare workers in the United States who are putting themselves at exactly the same risk, but they're not overseas. I don't think anyone in New York or New Jersey is talking about quarantining the workers at Bellevue Hospital, for example. But right. That would be consistent with what their position is. I think we can find common ground that protects the population and does not discourage people from putting the fire out at the source in West Africa.
So you know the governors of 4 U.S. states disagree and say the federal guidelines don't go far enough. There are reports that the White House is pushing back and asking them to rescind this. Do you believe that this all started spiraling out of control after what happened at the Dallas hospital?
Well, I think what happened at the Dallas hospital obviously involved a lot of mistakes, and people are eager to avoid those mistakes. But as I said, I think we have ample common ground to achieve some sort of accord here because everyone involved wants exactly the same thing and is dealing with the same scientific facts. We can come up with a policy that protects the population, that doesn't discourage people from going to West Africa to treat it at the source. We can do that. I think we just have to sit down at the same table.
This nurse who just returned from Sierra Leone and is saying that she is asymptomatic. She's very upset. She's exploring her legal options. She's sitting reportedly in a tent, really upset about things. So medically speaking, you feel like at this point it would be okay to let her go?
Yes, I do. Yes, I do. I think that there's a difference between quarantining and monitoring. I think clearly we need to monitor people because I guess the concern people have after, for example, one of the nurses from Dallas decided to take a flight over to Cleveland, I think it was, for wedding planning and then flew back while potentially symptomatic and feverish. We want to avoid that. And clearly an entirely honor system-based approach, I think, is not the way to go, and people recognize that. But again, there's a great deal of distance between mandatory monitoring and living in a tent at the airport for 3 weeks.
Okay, so Dr. Craig Spencer is the doctor in New York who contracted Ebola in Guinea. His symptoms have worsened. Tell us what you think his prognosis is just from the information that you know, and also remind our viewers about the hysteria surrounding this and exactly how you can contract this and what your odds are of even getting it.
Well, again, if you haven't had any contact with the bodily fluids of an Ebola patient, then your odds of getting it are effectively 0, right? So unless you've been in contact with the patient or potentially with a symptomatic person who's been providing care, then your odds of getting it are 0, right? That is a 0 probability, I should say, that you're going to get it. In terms of Dr. Spencer, I don't know his medical history and whether there are any facts in his medical history that might change this, but I think his prognosis otherwise should be excellent. Certainly we found that when provided with a Western standard of care and potentially with some experimental drugs that we're working on, but even just with basic care as we expect as a standard here, the prognosis is good, right? Again, the 2 nurses, they're doing fine, right?
Do you expect the U.S. states to stand their ground, even with pressure from the White House?
Well, I guess that's a political question. Again, I think there's ample room for people to come together, sit down at the same table, and come up with a plan that protects the population. As to whether politically people, whether at the White House or in the states, are able to do that, I'm not sure.
All right. Dr. Joel Selanikio, thank you.
It's a pleasure.
Appreciate it.